Glad today the attendance before prayer is 147. We want to maintain that punctuality and regularity. I expect the same from all the participants. This is a juniors class. We are working on the fundamentals of homeopathy. In fact, you will be surprised that many seniors are attending the class. I want seniors also to attend for one reason. It will be refreshing for them, as well as they can remember whatever they know. And also there are some people who have not attended my earlier classes. For them, unlearn to learn. You might be already knowing homeopathy, might have learned directly from books or through some other masters, does not matter. I am going according to a particular syllabus and a system. So if you are really interested to learn homeopathy sincerely, you please follow the notes and the points given by me in the class. And also you are expected to note down the running notes as much as you can. We want to upload the lectures in the Telegram very soon. We'll do that. Even the notes also we are trying to upload. If at all you miss by some chance, you are not able to attend the class, you can go through it. You can come again. One or two classes you miss, you can attend again, because I am not aware who is attending, who is not attending. It is not offline class where I see you personally. It is online class. That means I am teaching myself. My picture is very clear to me in front of me. I am sitting and I am teaching. It is the master who has initiated me into the homeopathy, and I have been teaching homeopathy for the last 43 years. So with the experience of teaching and with the clinical experience of more than 53 years, I would like to impart whatever little I know or whatever master has granted me, that I want to distribute to all. So today is a class number 3 for juniors. Already 2 classes we have covered. Most of you, I request you to go through the notes once again, because this is very important that you should revise, remind, and again read again and again. So the organs are not the man, that was told in the first class. Man is prior to the organs. And what is that when leaves the body, making the person as dead? That also we told. It is the vital force or the pranic force. And that is left, that has left the body. Hence we call it as body. The man is nothing but will and understanding, I told. So dead person cannot will or understand. A person with life only can do it. And a person with life is unable to do that, means is sick or having some kind of sickness. That sickness can be cured with homeopathy only, because homeopathy is the only science which directly works on the vitality of the person. I have been telling from the beginning that let us not criticize any other system. Allopathy, Ayurveda, or other systems. Let us not tell bad about anything. Let us praise our system. Let us tell good about our system. We can do that, but we have no right to criticize others. And I repeat, every system has got its own advantages and also disadvantages. Every system has its own limitations, including homeopathy. Don't think that we can cure anything and everything. It's not possible. When the organs are damaged, the tissues have gone beyond a repairable state, even homeopathy cannot help. Only when there is a problem, I tell you today's class I will cover that point, which is in the sensations and feelings, homeopathy can cure them very well. Unfortunately, when the disease has not descended to the physical plane, it is only in the mental plane, they approach other systems of medicine. Whereas homeopathy is best suited them. So today, I am going to tell about that very clearly. These preliminary classes, we have actually divided 50 classes for juniors and 25 for seniors. These classes will help you a lot to know about homeopathy fundamentals. Even the seniors, I repeat, if they leave the fundamentals, if they forget the fundamentals, only therapeutics or only medicines, only materia medica, you will be a failure. And giving two medicines at a time, or three medicines or multiple medicines, is not homeopathy. It can be given like that for veterinary purpose, or at a case where it has gone beyond repairable state and where complete restoration of health is not possible. In such cases, in acute conditions, we may have to give one or two doses, not mixing them, but one after the other. That is also an exceptional case. So let us now bother about our system. What is true classical system? We are called as classical doctors. The modern homeopathy or the homeopathy which is taught in the homeopathic colleges. Many of the doctors, they do not give much importance to either philosophy or the organon. Why? Because it is an abstract subject where it can neither be seen nor can be shown. If the students ask any questions to show where is the prana or what is the kind of the prana or how the simple substance exists, these questions cannot be answered unless you have a spiritual knowledge along with the Puranas and astrology, etc. You will not be able to answer them very well. Number 2 point, what we have to learn here is Dr. Hahnemann, though his name is Samuel Christian Frederick Hahnemann, but he has told about the Bhagavad Pada Shankaracharya's philosophy. So this is very, very important. If you know the philosophy well, it is very easy for us to learn homeopathy. The philosophy means it is an abstract. I cannot show you if you ask some questions, but with examples, I can tell you. It is the feelings and sensations. And even knowing the homeopathy also is internal. We have to learn from within. That is very, very important. Today's notes will start. Please note on the first point. I request all to keep a good book and pen. Same book. Don't bring one book for each week. No. Same book. You have to read again. The notes, whatever you take down, that will be, I'm giving only bullet points, not all the points. So those can be read again and again so that you remember them well and you will understand the science in its totality. Totality is the word we use in homeopathy several times. That is the important keynote we have to remember whenever you give a medicine, either for a chronic problem or acute problem. In acute also, we go for acute totality. In chronic, we go for chronic totality. But totality is a must. You must understand the whole case as a whole means you have to study the case in total. In total includes the person's symptoms, physical genders, physical particulars, mind symptoms, sensations, and all put together is called whole. Please note on the point. It is the sole duty. It is the sole duty of the physician it is the sole duty of the physician to heal the sick. To heal the sick, but not the results of sickness. but not the results of sickness. According to aphorism number 1, stated above, already aphorism number 1 we have discussed with you. Aphorism was stated above. It is the restoration of health. It is restoration from sickness, which is called as cure in homeopathy. So I repeat again, health is the natural condition, sickness is the disordered condition. So when the natural health is always there, that health is to be restored, not removal of sickness. From sickness, which is called as cure. Yes. Next point. This means health is a natural condition. And the sickness is artificial. Full stop. It is to put in order. It is to put in order the interior of the economy, INTERIOR, interior of the economy, that is the will and understanding, so the order is always from interior to exterior. If the interior is put to order, that means it is restored, then will and understanding are no normal. That means patient has regained the health. It is not removed, disease is not removed, but it is regaining the health. That is important. Next, tissue changes are of the body, and they are resultants of the disease. They are resultants of the disease, and they are not true diseases. They are not true diseases. Very clearly, Hahnemann has said, the results of the disease are not true diseases. The diabetes or thyroid or some other problem, they are all already sickness is there. They are the resultants of the disease. They appear after much time, after the cause is there inside. Homeopathy works on the cause and removes the cause. Cause is removed, automatically effects are. This is the only science. I repeat again and again only for one reason. You have to get a lot of interest to know homeopathy. This is the speciality of homeo system. Next slide, please note down. Hahnemann clearly said, Dr. Hahnemann clearly said that there are no diseases, but only sick people. See the difference in this statement? There are sick people, but there are no diseases. How is it? When sick people are there, they have diseases. But here, homeopathy clearly takes the cognizance of sick people, but not the diseases. When the person says, I am not well, we will catch hold of that person who is talking. It is not the diagnostic laboratory reports we catch. But here clearly said, there are sick people, but there are no diseases. Diseases are names given by other systems of medicine. We don't name any set of symptoms as a disease. They will help us to find out the disorder or the place of the disorder. All those things we can understand. But according to homeopathy, there are only sick people, but no diseases. This is a very important statement you must understand. I have only compiled important statements only, not the entire notes. Okay, next. So the disorder is of the government. In bracket, that which governs the body. And this proceeds from within to outward, and finally culminate into some pathological changes in the tissues. Pathological changes in the tissues. Is it clear to you all? This, if you understand, you know 50% of homeopathy. When the person comes to us, when the patient comes to us with certain set of symptoms, what we have to see is the patient first, the person first. Then when you note on the case in detail, you will understand what is the cause of the disease and what is the miasm is holding, and because of that, what are the outcome of these symptoms. The symptoms will only guide us to find the right remedy, because Hahnemann and his followers, who proved the drugs on healthy human beings, they are called provers. The drugs are not tested clinically on any animals or rats or mouse or etc. No. The healthy persons were given the crude material, and when they came out with certain symptoms, those symptoms are noted down, and finally materia medica is prepared. All the drugs are tested on healthy human beings. What is miasms, I will tell in the next classes. Don't worry. Just miasm, one word you note down. Miasm is called in homeopathy as disease cause, which is present in a very latent state in the person. I will tell much in detail about it later. Next point. The bacteria are results of the disease. The bacteria are the results of the disease. And they are not the disease cause. And they are not the disease cause. We give medicines, the antibiotics what we use to kill the bacteria, not only the enemy bacteria, even friendly bacteria are also killed. Because of that, the immunity power is going down. The much strain to the vital force, and recovery of the patient is delayed, and also results in many side effects. In homeopathy, we never use antibiotics. We will not use any steroids. There is again a campaign or miscomprehension, negative publicity on homeopathy, that in homeopathy steroids are being used. I'm sorry. We will not use any steroids. All the medicines are given in potentized form. We don't give any crude materials, and no steroids are used. Why people are getting confused as steroids? Because when the right medicine is selected, patient gets instant relief faster than steroid of other systems. Faster. Yesterday evening, I got a case to our clinic. A girl of 20 years old suffering from severe stomach pain. When I asked her the cause, she has taken some outside food. I gave her, according to the symptom, vomitings are there, motions are there, very, very sad feeling, and almost literally crying face. I gave her pulsatilla, 31 dose. Instant relief has come. That is possible only by using steroids. That is also not instant. But homeopathy gives instant relief if you can give a right medicine. Why I am telling this example is no steroids are being used in homeopathy, and somebody asks you, you tell very clearly all the medicines are tested on healthy human beings and they are given in a potentized form. Potency. What is potency? I will explain. I am only introducing certain technical terms to you at this stage, and later we will deal them in detail. Any doubts are there? You can ask at the end of the class. I will clarify. Okay. These things are in CAM, that is upcoming classes. We will be telling about that. Next. So the bacteria are not the results. Bacteria are not the cause of the disease. Now, they come much after. They come much after the symptoms, and they work as scavengers, and they work as scavengers accompanying the disease, and they are perfectly harmless in every respect. This is very, very important. And when the bacteria is present means we should understand one point. They come much after the disease entered, and they work as scavengers to clean all the bad materials, and they save the patient. This you must understand very clearly. And they are not the disease cause, they are scavengers, and they are good for the patient. Next point. They are the outcome of the disease. They are the outcome of the disease. Full stop. Present day medical systems, present day medical systems are trying to name the disease based on a set of symptoms, and cure them. Full stop. I will tell full stop, then only put the stop. Homeopathy treats the person in holistic way, according to the totality of symptoms, and the name of the disease is the name of the medicine used. If somebody comes and asks, sir, what disease I have? Many people ask because we have orientation towards the allopathic system of medicine. As a true homeopath, what you have to tell is the name of the medicine what we give is the name of the disease. Suppose we have given, for example, Naxwamika. Dr. Kent gives this example. Person will come and ask, sir, what disease I have? We have to tell, yes, you have a disease by name Naxwamika. And he will search in the Google, where is Naxwamika? Naxwamika is the name of the medicine suitable to the totality of symptoms of that person. And that is the solution to the problem. If you can understand this point clearly, very easily you can select the medicine. That is not a problem at all. Next point. A patient of 25 years of age, with gravest inheritances. A patient of 25 years of age, with gravest inheritances, with 20 pages of symptoms, with 20 pages of symptoms, and with only symptoms, to furnish an image of sickness, is perfectly curable, if treated in time. I repeat, a patient of 25 years of age, with gravest inheritances, with 20 pages of symptoms, and with only symptoms to furnish an image of sickness, is perfectly curable if treated in time. We have a doubt. Suppose the patient has come with gravest inheritances, like father was having diabetes, mother is having BP, and brothers are, somebody is having some other symptom. Gravest inheritances, let it be there, no problem. And the age of the patient is given as 25 years. That is the average age. So whether he may be 0 or 1 day baby or 50 years old, no problem. And with 20 pages of symptoms, remember, you have to note down each and every case in that detail. All symptoms only to furnish an image of sickness, but not the sickness itself. What is the difference between image of sickness and sickness? Image means patient feels as if he has some problem. Patient feels my stomach is burning, like charcoal burning. He feels that there is a moving object in my, moving animal in my stomach. Is that in the head, it is being burst into pieces, which is all the feelings only. When he comes to you in the clinic, he says, my head is breaking. It will not break if you see. He is normal only. But he feels as if it is broken. He feels as if it is a charcoal burning in the stomach. There will be nothing to burn. But like that, 20 pages of symptoms he may give to us. Does not matter. The gravest inheritances does not matter. But symptoms are there only to furnish the image of sickness, but not sickness, is perfectly curable, subject to one condition, if treated in time. What is in time? That means if the symptoms are there only at the functions or sensation level, but not descended to the physical level. Pain is also a symptom of the mind. You see the pains where many people have, suppose, headache. You ask the person, where is headache? He says, sir, it is on the right side for some time, then on the left side, then it goes to the vertex, then occipital region. Why? If the pain is there, it should have been only in one place. That like that. Suppose that is only an image of sickness, but not the sickness. Many times pains are only mental symptom, but not physical symptom. Physically, he may be suffering. He may say that, yes, this hand is paining. If there is an outward or external injury, some accident or something like that, then the injury or the pain will be physical. Unless the dislocation is again properly kept in location, like a fracture, the pain continues at that place only. It will not shift to the place unless we keep the orthopedic surgeon or the homeopath keeps it back into the proper location. Pain continues. That pain is localized pain. That also can be cured with homeopathy. It is possible. We have got medicines for that symptom also. So, this is one point you should understand. Next. The homeo is the first priority. The homeo is the first priority for any patient with the image of sickness and if medicines are taken, homeo medicines are taken, homeo medicines are taken, he will go to old age. He will go to old age without any tissue destruction, without any tissue destruction. Full stop. Hence, the children below the age of 15 years, if they are given homeopathy for lifetime, they will not get any chronic problems. They will not get any chronic problems. Okay, next point. This point you understand. Children, first preference should be homeopathy. From day one, I gave medicines to infants of 1 day old. Many people feel whether is it safe to give homeopathy at that age or days baby. It is a very safe, very, very safe. If homeopathy medicines are given, I repeat, when there is only an image of sickness, if it is treated with homeo remedies, the person will go to old age without any tissue destruction. Without any tissue destruction. And the children up to the age of 15 years, if they are given homeopathy for lifetime, they will not get any chronic problems or chronic diseases. Okay, next point. Prescribing for the results of disease Prescribing for the results of disease causes changes in the results of disease prescribing for the results of the disease causes changes in the results of disease, but not in the sickness or the disease cause, or but not the sickness or disease cause, except hurrying the progression of the disease, except hurrying the progress of the disease. So when we are prescribing for the results of disease, only change is found in results of disease, but not the disease cause itself. If the fever is there, fever will be temporarily removed. And that too you have to repeat for every 6 hours or 8 hours according to this one. And after 3 days or 5 days, some antibiotics are used in one course. Then after 5 days, the body naturally recoups, gets back its strength and fights with the disease cause. That is how the persons are getting cured. In homeopathy, we give strength to the vital power, which is already doing this job of fighting with the disease and saving the patient. We have a natural mechanism God has created in us that it can work fighting with the disease and sending it out. That is why in some cases, many people, even our elderly people, some 5, 6 decades before, and there is some problem, they used to just to do fasting and then take plenty of water and take rest. This is God. They were not using any type of medicine. During my childhood, I observed many people, they don't take any medicine at all. They just take rest. Of course, they were not software engineers at those days. There is no office to go. They will be doing all domestic works or some small jobs. They can apply leave and sit in the house. There were no hurry. There were no tensions. There is no stress for them. And plain food they are taking. No tinned food. No preserved food. Disease spelling DISEASE. DISEASE disease. DECASE disease means death. DECASE disease means death. But DISEASE disease means some disorder. Okay. No. Next point. Next point. The fundamental condition of the disease cause of human race must be understood. Otherwise, it is impossible to understand acute and chronic diseases. We should always go to the fundamental cause of the problem. If you understand that, you will understand what is chronic disease, what is acute disease, etc. Without understanding the fundamental cause, it is difficult to estimate that. Next point. We have to study the theory of susceptibility. Aphorisms 30, 31 and 32. Aphorisms 30, 31 and 32 of Organon. 30, 31 and 32 of Organon deals with the theory of susceptibility. They deal with the theory of susceptibility. In many cases, the human body is affected by medicines in crude form. I will explain. After the COVID has come, we have clearly understood what is susceptibility. The persons who are susceptible to disease are only affected by COVID. The persons who have enough vital force, they are not affected. The persons with weak strength, vital strength, are more susceptible to diseases. Somebody of them have all died also. If you understand this point, aphorisms are the Organon principles given by Dr. Samuel Christian Frederick Hahnemann. This is the Bhagavad Gita of homeopathy. We have to understand each and every aphorism in detail. Then you will be a good doctor. The theory given by Dr. Hahnemann, after many years of practice in the sadhana, for years together he has done. And he has come to those conclusions. And he gave us. This aphorism number 30, 31 and 32, they tell about the susceptibility theory. You have to study it well to understand. Here, Kahneman is clearly telling many of the times by taking medicines in crude form, they are creating so many diseases. Many diseases are drug-borne, drug-induced. It is unfortunate. Why it is unfortunate? Because when we are not having awareness of an alternate system to allopathy, this is the result. When people know that there is an alternate and try homeopathy or some other systems, alternate to alternate to allopathy, this problem would not have come. Because we were ruled by British for more than 200 years, they have left their legacy of English medicine and English education, which has spoiled the country. Those two things they left. And the third is, there is no unity amongst us. We are enemies to our own people. That also Britishers have taught us. They have divided us. When they have left their medicine, we call, even allopathy, we call it as English medicine. And the convent education is called English convents. There were days where the children were taught in the Sanskrit and the mother tongues. They were having much knowledge than the present day education. This is the British people have spoiled this. And Hahnemann, though he is not an Indian, but he followed the Indian theory of the Vedas and Puranas and found out the system with Advaita Siddhanta, that is non-duality, as the basis of the medicine. Okay. Right. We will deal again in detail with that. Next note down. These natural diseases without chemical medicines can be cured by simple homeopathic medicines. The real medicine works on the person and stimulate the vital power to fight with the disease cause and cure the patient in a natural way. Hence, cure the person in a natural way. Hence, homeopathy has no side effects. Hence, homeopathy has no side effects. We are typing and giving you the text so that you can follow it. The person who is typing is also listening simultaneously. And the medicine is the text that is given by me, the notes is extemporal. Sometimes if you ask me to repeat, I may not be able to repeat in the same way. Does not matter. We'll try our best to teach you. So, this is one important point you should understand. When a medicine is given to the person, it should always cure the patient by stimulating the vital strength or the vital power which is natural, given by God, which is in us. The capacity everybody has. That will fight with the disease cause. If that vital power is overpowered by disease power, we need some medicine to stimulate the vital power or to give strength to the vital power so that we gain strength to already we have some disease fighting power with us. That can overcome the problem and it will solve the problem. This is the theory of homeopathy. We should understand very clearly. Otherwise, we will be losing the good health for the bad medicine. Many cases, our clinical experiences, they show very clearly people are made sick because of the medicines. When we ask them to stop certain medicines, health is automatically restored and people are becoming normal. But we don't have guts to stop the medicines, particularly when vital organs are involved, like either liver or kidneys or brain, heart, etc. All those vital organs, to maintain them, medicines are given, and we will not be able to stop them because stopping such medicine may totally make the person collapse. That is the reason we are living on medicines. We are not living on earth. We are living, many people are living on medicines. If they don't take medicine for 5 or 6 days, some problem will come. And it is not guaranteed that problem will not come even if they take medicines regularly also, they may get some problem. So this is the theory we must understand. And these are the vital points I told you. Now Recording can be continued, of course. Now it is a time for questions because 9 minutes I am giving for questions, and any other questions we can ask. Okay. VVRK Shastri sir based in Bangalore. I am in Bangalore. Okay. Satyanarayana?
Yes, sir.
Yes, sir.
Please, who is in queue?
Yes, sir,
Stand up.
sir. I think Venkata Gudladona.
Venkat.
Venkat. Okay. Varaprasad.
Sir, you said internally present vital power. My doubt is vital power is equivalent to inherent immunity? These days in COVID, people used to talk about.
Names are different. Don't worry, don't get confused with the nomenclature. It is the power that is saving the person from diseases.
Sir, one last doubt. Sir, you have said about pulsatilla about one patient who
Yes.
came to you. Sir, you said about physical symptoms, but sir, you said that we have to study person. Sir, may I know what are the things in that person, sir, to be given for pulsatilla?
Are you a senior or junior?
Junior, sir.
Junior. Wait for some time, you will understand.
Okay, sir.
Let the classes be over, you will understand. In course of time, you can learn. Okay, Professor?
Okay, sir.
Thank you. Next.
I think right now no one has raised any, sir.
No one has raised that.
Sairam Dvivedula.
Sairam.
Namaskaram, sir. మీరు చెప్పినట్టు టిష్యూ చేంజెస్
Madam, your voice is people. Can you put your mic inside nearer to your mouth and can you speak out?
and resultants of the disease and they are not true diseases అన్నారు.
What's your doubt?
అంటే టిష్యూ చేంజెస్ బాడీవే అయినప్పుడు మరి మనకు తెలుస్తుంది కదా, అంటే మనలో చేంజెస్ వచ్చినట్టు దానివల్లే కదా మిగతా కాజెస్ అన్నో జరుగుతాయి. బాడీలోని పెయిన్స్ ఏదైనా సంథింగ్ అంటే డిసీజ్ వస్తుంది, కానీ అది డిసీజ్ కాదన్నారు కదా, దాని అర్థం ఏంటి అని.
Diseases the diseases will be first seen in the internal interior of the economy. That means internally. Suppose example, you are irritable. Where is the irritability? Can you show the irritability? You are irritable, you are sad. The patient is very, very depressive. Patient is not having proper appetite. They are all the symptoms within the interior of the economy. If they are not attended in time, then tissue changes will come. But these are the symptoms from the beginning. I will give you one example, straight example. Yesterday, one more case. A boy of 10 years old, parents have complained that he is addicted to cell phone. If you take cell phone from him, he will become very wild, almost mental. They are unable to take the cell phone from him, and he just throws the things out and everything. What are these symptoms? These symptoms are of the mind and the internal. If they are not cured in time, that boy will become a diabetic in course of time, may become some thyroid problem, may come to some other problem. Then after pathological test, you will find out, yes, this is the change in the pathology. But much before that, he is irritable, he is depressive, wants to commit suicide. All the symptoms are there in the person.
అదే మీరు చెప్పినట్టు అందరూ సిమ్టమ్స్ బయటికి చూపించరు కదండి, చిన్నపిల్లడు కాబట్టి బయటికి తెలిసింది, పెద్దవాళ్ళు అయితే తెలియదు కదా మనకి. దే విల్ హైడ్ ఎవ్రీథింగ్. నో,
Yes,
అది ఎలా తెలుస్తుంది?
if you come with practice of some senior doctor, you will understand by experience. Okay. Next.
Monica Jayanti.
Sir, namaste, sir.
Namaste.
Sir, I just wanted to understand what is the minimum age, like 6 months or 1 year, until what age can we take medicine?
From 1 day baby to 100 years old person, we can give homeopathy.
Okay, okay.
From just born,
Hmm,
just going to die,
hmm.
we can give homeopathy.
Okay. And also during homeopathy, usually patients they say that don't consume coffee or those things. So is it any disease specific or the based on symptoms or in
For
general?
everybody,
Yeah.
coffee is a medicine,
Mm-hmm.
tea is a medicine. And when we are giving one medicine, he simultaneously takes some other medicine. Our medicine may not work.
Okay.
It neutralizes. Coffee neutralizes homeopathy.
Okay.
Hence, we advise it's a common restriction for all homeopathy patients, not for particular disease.
Okay. Okay. Okay, sir. Thank you.
Thank you.
Rakesh Kumar.
Sir, good evening. Rakesh Kumar from Dehradun.
Dehradun, yes, Rakesh.
Sir, it is a very small doubt in allopathic systems when doctors.
Sir, voice is low, very low, sir. Rakesh Kumar, sir. Could you please?
Okay, I come closer near to the mic, sir.
Yeah, yeah.
Yes, tell me.
Sorry to understand. Sorry to say, but
Don't mind, sir. In allopathic systems, when doctors find no treatment for any disease, also where from it has emanated and no cure, they say it's autoimmune disease. Can allopathy help in such symptoms by providing this immunity drops?
Allopathic immunity drops, I don't have anything to
No,
comment.
no, sir. Allopathy people, they say it is autoimmune disease.
Okay.
Can homeopathy immunity
Yes.
drops
Yes,
help in such cases?
it will help.
Thank you so much.
Next.
and next is Renu Gupta.
All those who raised their hands, please stand in queue.
Papaya Mailapalli.
Sir, namaste.
Namaste.
Sir, as a senior doctor, I want to clarify from you, sir.
Where are from?
I am from Srikakulam, sir.
Srikakulam, tell me.
Sir, క్రానిక్ డిసీజెస్తో కొంతమంది ఈ ఇంగ్లీష్ మెడిసిన్ వాడుతుంటారు. వాళ్ళు హోమియో మెడిసిన్ తీసుకోమంటే హోమియో తీసుకుంటే అవి మళ్ళీ తిరగతోడుతున్నాయి, మళ్ళీ ప్రాబ్లం ఇంకెక్కువ అవుతుంది అని ఒక మాట అంటుంటారు. అది ఎంతవరకు కరెక్ట్, మీరు కొద్దిగా క్లారిఫై చేయండి సార్.
See, they are taking allopathy presently. Suppose body has become addicted to that system.
Yes, sir.
And the allopathic medicine will maintain the readings and everything. If they stop suddenly, all those things will go up. Suppose a diabetic patient using allopathic medicine, suddenly the readings will go up naturally. Hence they have that fear. So we have to slowly reduce the allopathic medicine and give homeopathy, then they will understand. It should not stop immediately, suddenly.
Okay, sir. ధన్యవాదాలు సార్.
Dhanyavad. Next.
I think Ajanta, Priyanka Bhapatla. She is not responding. Amruta Sarvesh.
Sir, very good evening. Sarvesh from Hyderabad. Hello. Sir, can you hear my voice?
Go ahead, sir. Sir, we are able to hear you, sir.
Yes, sir. Sir, just wanted to understand. I just noticed, those who
Who is
missed
this?
this class. No?
Who is this?
Sarvesh from
Amruta, could you
Sarvesh
please elaborate
from
from where you are calling?
Hyderabad, sir. Sir, can
From
I?
Hyderabad. Tell me.
Sir, I just wanted to understand when this class, because I just joined, I lately joined. So when this class gets uploaded, sir, the class video?
We will shortly upload it.
Acha, sir,
Yeah,
one more question I just
Within
wanted
short.
to. Sir, there is a, I mean, I don't know whether it's misconception or fact, but there is a, some noise about this homeo. Homeo, treatment takes a longer time. It delays. So how far it is true, and why this, if at all there is a conception, why the misconception has been raised?
It is a misconception, number one. Number two, I don't know who has.
Why it has been the reason, sir? Why? Yes, fine, sir.
I'm telling you, reason. When I started telling something, you should keep your ears only open. When I opened my mouth, your mouth should be shut. Number one. Number two, people who are telling that homeopathy is slow, I have been searching for the last 53 years who started that. I'm not able to find out that person. Number one. Number two, they have used many other systems. Finally, they come to homeopathy. By that time, lot of damage is done to the internal organs. To saturate those organs, naturally, it will take time. Hence, they will brand homeopathy as slow. That is another reason. If it is a virgin case, first time they are coming directly to homeopathy, and if the doctor is properly, if he selects a medicine, then doctor is a good doctor, homeopathy is instant. It is only myth that homeopathy is slow. It is not slow. Next.
Sir, with your permission, can I update one point here, sir, if you don't mind?
Yes.
Basically, you people may not know, I'm a bronchitis patient for 22 years actually. It was started around in 2000, and I used allopathy, Ayurvedic, it didn't reduce. When I started to use homeopathy, it didn't reduce for me for some time. Along with the allopathy, I used homeopathy. So it took a lot of time to control myself from bronchitis. After purely homeopathy, it started reducing for me, but still I was facing an issue because I used to drink tea or coffee or some other masala food spices actually. So after 20 years, last 2 years back, I met Guru Garu, and he has given me only one dose. Previously, 20 years, he used same air salt medicine with some other dose, and Guru Garu has given only one medicine. Honestly, people may not understand. After three weeks, my bronchitis reduced. Now I'm purely controlled from bronchitis from last 2.5 years. I used to take bath, hot water when I went to my native place near Eluru or Vijayawada in the summer also. Now I took bath in the February with cold water. This is the miracle of homeopathy and from Guru Garu's hands. If you believe or not, this is my real-time experience. That's why I want to share here. Sorry if you may disturb my Guru Garu's information from you. I'm extremely sorry for this one.
Next.
Thank you so much.
Yeah, Praveen.
Hello, sir. See, my question is, sir, on the, I think it is somebody else also asked the same
You are
question.
from? Praveen from?
Praveen from
I'm from Bangalore, sir.
Rajahmundry.
Bangalore.
Bangalore.
No,
Your
Bangalore.
voice is a little bit.
Okay.
Tell me, what is your doubt?
Sir, somebody else also asked the same question. Like, when we go to homeopathy doctor and the patient is already taking the allopathy medicine, they'll say you continue with the allopathy medicine and also take the homeopathy medicine. So here, so my question is, if I'm understanding it rightly, the allopathy medicine that they are taking is in the crude form. So the damage, maybe it is healing the person as well as it is also creating a damage along with it's because of the crudeness of the medicine. And how effective the homeopathy medicine will be in those cases?
You ask any patient. No, just no Satyanarayana sir has told. Allopathy used, but after taking homeopathy is cured. It is effective. Okay?
Okay.
The
So in
proper
that
medicine
case,
is given.
in that case, we have to completely gradually reduce the English medicine.
Slowly, gradually reduce and take homeopathy. Yes.
Okay.
Next.
Thank you.
Ashish Kumar.
Sir, namaskar, sir.
Namaskar.
Sir, my question is that
Where are you
there are
from?
two parts. I'm from Bhopal, sir.
Bhopal. Tell me, Ashish.
Yes, sir. Sir, my question is, for example, one patient, if he or she is suffering, is having, for example, they are not having any baby, all their tests are coming negative, in the sense normal test.
Normal.
Every test that, yes, every test that a doctor has asked them to do, it is coming normal. And
Yes.
still yet they are not able to conceive the
Infertile.
baby.
infertility. Okay. What's your doubt?
Sir, my doubt is if all the physical tests are coming normal and all the physical tests are normal, where is the problem lying? In the sense, where is the
In the internal economy of the person, both the persons. That can be
that would be,
rectified.
sir,
That can be rectified with homeopathy.
that is emotions, feelings, or something else, sir?
Yes, inside. Many layers are there.
Spiritual, spiritual.
You can call. Those doubts, those words will confuse us. So it is the interior of the economy.
Okay, sir.
That can be
Thank
true.
you.
With homeopathy, we can set right.
Okay, sir. Thank you,
Next.
sir.
Lakshmi AVS.
Namaste, sir. I'm from Delhi, Lakshmi from Delhi.
Delhi. Tell
Yeah.
me.
So you said that, I mean, if treated in time, for that you said that in time means in physical body.
In
Yeah.
time means when the symptoms are there, only to furnish the image of sickness, but not sickness. That is, which has not descended to the physical plane.
So like, I mean, diabetes, like in those are also kind of physical body, like,
Yeah,
but then
diabetes and other things will take time.
will take time, but
Yes.
still they are curable, right?
They are curable.
Okay.
Next.
Thank you.
I think Ajanta Kannan.
Yes, sir. Ajanta from Tanjavur, sir.
Tanjavur, tell me.
Many people are facing many side effects after taking this COVID vaccines, sir. They have
Yes.
taken 2 doses, 3 doses. Is there anything that we can give in common from homeopathy that can help to reduce this?
Common, we cannot give common. There is
So
only
it's
one medicine by name Thuja, Thuja, which works against the vaccination, bad effects of vaccination. That is the common medicine. But again, individually, we have to go through the case separately.
so it's
Thuja 30, that is against vaccination, Thuja can be given.
how many doses, sir?
2 or 3 doses, weekly once.
Okay, sir. And I have one more question. It's all from the chat only. So if people are, children are getting eyesight issues, so for that also, can we treat it with homeopathy?
We can treat, but natural sight may not be restored because there is internal problem. Already
Okay.
damage is done to the nerves. Potency of Thuja is 30.
Okay. And another question, sir, regarding to the mobile addiction for these days, children, not only children, even adults are also getting addicted to mobiles these days. So is
Yes.
there anything for saving these people, sir?
Difficult. I am also doing research on that. Individually, symptom-wise, I am going, but no specific medicine for that purpose, except the meditation, yoga, and other spiritual practices.
Okay, sir. Thank you very much, sir.
I am teaching them spiritual practices, yoga and meditation. That will help. I am also a psychologist.
Okay,
I am
sir.
a
Wonderful,
qualified
sir.
psychologist.
Wonderful, sir. Thank you, sir.
Wonderful. Wonderful. Thank you. Next, be fast.
Sorry, sir. Roshan Bhatta.
Hello, sir.
Be brief.
Namaste
Yes,
to
Roshan ji.
everyone. So I
कहाँ
wanted
से?
to ask
कहाँ
one
से?
simple
Where
question
from?
like, how do I start on homeopathy? Like, should I prescribe drug, ask dosage, or give like every session or something?
You want to learn homeopathy?
Yes.
You attend these classes for 6 months. We will decide later.
Okay. Yes.
Thank
Thank
you.
you, sir. So another
Next,
thing, I have. Can I give a dosage of like for the pain in the back pain or something?
you are not permitted to give medicine on 1 dose. I will tell about biochemic salts. Those you can use. Wait for some time.
Okay. Thank you, sir.
Next.
I think Rakesh Varaprasad is over. Roshan Bhatta. Athwata Srinivas. Okay.
Be fast.
Bharti N. భారతీయన్.
యా హలో సార్. నా పేరు భారతి. నేను హైదరాబాద్ నుంచి సార్ మాట్లాడుతున్నా.
Yes,
సార్. సార్ ఇట్లా మనకి షోల్డర్ పెయిన్, బ్యాక్ పెయిన్ ఇలా డిస్క్ ప్రాబ్లమ్స్ వల్ల ఇలా వచ్చుంటాయి గదండీ సార్. అది మనకి హోమియోపతి వల్ల మళ్ళీ అంటే ఇట్లా డిస్క్స్ రీఫార్మ్ అవ్వడం అలా మనకి ఉంటుందా సార్ అది? లేకపోతే అది
it can be restored if the damage is not done, too much damage is not done.
ఓకే. ఓకే.
చాలా
ఓకే సార్.
ఎక్కువ డ్యామేజ్ అయితే కాదు.
ఓకే. సార్ ఇప్పుడంటే ప్రెజెంట్ మేము ఇప్పుడు ఇంగా స్టిల్ లెర్నింగ్ స్టేజ్ జస్ట్ స్టార్టింగ్ గదండీ సార్. ఇప్పుడు మేము కన్సల్ట్ చేయాలి ఒకవేళ మిమ్మల్ని దేని గురించైనా
There are doctors in Hyderabad, many doctors are there in Hyderabad, homeopathy. You want to consult me only, you ask
Yes.
Sriram, he will give you.
ఓకే సార్. ఓకే సార్. థ్యాంక్ యూ సార్. థ్యాంక్ యూ.
Okay, thank you. Next.
శ్రీ మహాలక్ష్మి.
నమస్కారం సార్. నా పేరు మహాలక్ష్మి, బెంగళూరు నుంచి.
Yes.
సార్ నేను సోరియాసిస్ ఎఫెక్ట్ అయిన పేషెంట్ని.
Okay.
This is 12 years back. I just want to tell my experience with homeopathy. That's why I came to this class also to understand. Just want to tell the people that, you know, giving our symptoms is the major thing to happen. Like ప్రతి చిన్న విషయం మనం కేస్ షీట్ లో ఇవ్వడం అన్నది చాలా ముఖ్యం. అండ్ నెక్స్ట్ ఇంకొకటి ఏంటంటే మనం సిమ్టమ్స్ మధ్యలో మారేమో అంటే కొంచెం కొన్ని మారుతాయి కదా సార్ మన ఆలోచన ధోరణి. అది మారినప్పుడు మళ్ళీ మన మందు అన్నది మారుతుందా?
మారుతుంది.
ఓకే. ఓకే.
సిమ్టమ్స్ మారితే మందు మారుతుంది. శ్రీరామ్ నీ ఫోన్ నెంబర్ అడుగుతున్నారు.
Sir, almost done, sir.
Yes, then we'll close the session.
Sir, one point I will add here, sir. One point I will add, if with your permission. మాలక్ష్మి మేడం, మీరు కనుక ఎవరైనా సరే మారితే సార్ గురువుగా చెప్పే పాయింట్ ఒకటే, మీరు రెగ్యులర్ గా మెడిసిన్ వాడాలనుకుంటే ఒక చిన్న డైరీ పెట్టుకోండి. మీకు ఒక సిమ్టమ్ చేంజ్ వచ్చింది రాసేసుకోండి ఇమీడియట్ గా. మీరు గురుగారి దగ్గరికి వెళ్ళినప్పుడు ఒక 15 days 20 days కాదు, వెళ్ళినప్పుడు మీరు క్లియర్ గా చెప్పొచ్చు ఈ సిమ్టమ్ పలానా టైం వచ్చినప్పుడు. అప్పుడు సిమ్టమ్ ఈజీగా ఐడెంటిఫై చేయడం ఉంటుంది. దిస్ వాట్ మై ఎక్స్పీరియన్స్, వాట్ ఎవర్ ఐ ఫెల్ట్.
యా అదే సార్. అంటే ఐఎమ్ ఆల్వేస్ థ్యాంక్ఫుల్ టు హోమియోపతి ఆర్ గ్రేట్ఫుల్. వాట్ కెన్ ఐ సే? ఇఫ్ వన్ డే దేర్ ఇస్
గాయత్రి భరద్వాజ్ సార్.
హలో సార్, నమస్తే అండి.
నమస్తే.
ఐఎమ్ ఫ్రమ్ అనంతపూర్ సార్.
చెప్పండి.
ఓకే. ఇప్పుడు ఆడపిల్లలకి హెచ్పివి వ్యాక్సిన్ వేయాలని గవర్నమెంట్ కూడా చెప్తుంది కదా సార్. సర్వైకల్ క్యాన్సర్ కి అది పిల్లలకి వేయించాలంటారా?
నేను ఇప్పుడు ఏమన్నా చెప్పానంటే పెద్ద ఇష్యూ, కాంట్రవర్షియల్ అవుతుంది.
ఓకే సార్.
మీరే డిసైడ్ చేసుకోండి.
ఓకే, థ్యాంక్ యూ సార్. అర్థమైంది. థ్యాంక్ యూ సార్.
శ్రీరామ్ సార్ నెంబర్ ఆల్రెడీ గివెన్ 9440493144. Amruta Sarvesh.
Sir, one more question, just wanted to understand, sir.
Please
could you
leave
just, could you just recommend any doctor in Hyderabad? I wanted to go and consult a doctor, sir. Any doctor that you would like?
Dr. Murali Krishna.
Dr. Murali Krishna. Okay. Fine, sir. Thank you.
Murali Krishna, phone number.
Yeah, if at all given, that would be grateful, sir.
Yeah. 98663 663 91867.
So I'll repeat 98663.
Shown on the screen, it is available. Delhi, we don't have anybody, Amma. Okay, thank you. We will meet again tomorrow for seniors class and day after tomorrow for juniors class. Thank you. Namaskar.
మిమ్మల్ని ఆన్లైన్ చేయవచ్చా అండి ఢిల్లీ నుంచి?
చేయొచ్చు.
శ్రీరామ్ నెంబర్ కాల్ చేయండి సార్.
కాంటాక్ట్ శ్రీరామ్.